My project is evaluating geriatric nutritional risk index as a predictor of health indicators in aging populations. My name is Arav Choudhary, and I'm a rising senior in East Brunswick High School. Since my freshman year, when I took biology for the first time, I've developed a love for it. It is by far my favorite science, and this year I placed in the top 5% nationwide in the Biology Olympiad. Another thing about me is that I play the double bass, the biggest instrument in the orchestra. I have been a part of the New Jersey All-State Orchestra 3 times, and I've loved every minute of it. Additionally, I golf for my high school's varsity team and volunteer to teach younger kids on the weekends. I'm learning how to play bass guitar in a band with my friends, and I like to watch soccer in my free time. Through the double bass, I've become committed to my local senior citizens. I only live 5 minutes from the senior center, and I perform there twice a month. Even before my interest in biology, which sprouted from my first time learning it formally, I have found food science exceptionally compelling. Through my blog site, fastfoodfrogfood.org, I've worked to investigate food science and make it simpler and more accessible for people. Over the past decade, people have been so obsessed with increasing their lifespan, but not so much their health span, or the period of a person's life when they are healthy and free from significant disease or disability. I have realized there is a lack of scientific research focused on improving the quality of life of geriatric populations. A startling statistic to help us dive into this topic is that up to 50% of older adults in hospitals and 30 to 60% in long-term care facilities are malnourished or at risk of malnutrition. Now, I realize that GNRI is a foreign concept to you, so let me show you what it is. Written out is the formula to calculate GNRI. It uses serum albumin, the most common protein in your blood, and BMI, which is calculated from height and weight. With just these 3 variables, you can calculate your own GNRI. My research began with finding a dataset related to GNRI. I found one published by the University of Vienna by Dr. Elisabeth Zeilinger and Dr. Matthias Unseld, which can be found at this link. The dataset covered 94 participants from the ages of 65 to 98, all in Austria. It covered many biomarkers, such as age, hemoglobin, BMI, anemia, GNRI, iron, and C-reactive protein. Before getting started in finding correlations, I'm going to walk you through my scientific procedure. To ensure the validity of this dataset, I compared variables that I would expect to see in relation to each other. Pictured here are the correlations between iron and transferrin, an iron transport protein, and hemoglobin and hematocrit, blood oxygen variables that are also expected to correlate. Seeing a 96.6% correlation and a 99.6% correlation respectively helps me be confident enough in the dataset where I can make findings and use this dataset to support my hypothesis. The participants were spread out throughout the risk categories. In order, there were the most in the moderate and low risk and lesser in the no risk. High risk was the absolute lowest, with only 5 in 94 participants exhibiting a GNRI below 82. The exact ranges of risk are outlined here. My findings isolated 4 specific variables. The first was mean corpuscular hemoglobin. When sorting the participants into their groups, I saw a strong correlation between GNRI and MCH, which is the average size of a red blood cell. As risk increases, blood cell volume decreases. The next biomarker was C-reactive protein, a biomolecule released in the body while and after fighting off inflammation. This informs me that patients at higher risk, as classified by GNRI, are more prone to inflammation. As risk increases, inflammation increases. Finally, there were 2 biomarkers which had high correlations and also go hand in hand with each other. Iron levels in the body grew inversely to the risk level. As risk increases, iron levels decrease. Transferrin, an iron transport molecule, follows the same trend as overall iron levels. As risk increases, iron transport decreases. If you are interested in the exact means, standard deviations, and R values representing correlation, feel free to pause the video and check out my calculations. Again, all of the numbers I got are from the same dataset from Professors Zeilinger and Unseld. The findings of my results are summarized here. GNRI trends were observed within mean corpuscular hemoglobin, C-reactive protein, and iron, enabling a potential for GNRI to be used to recommend specific diets in the senior population. Participants in the no-risk category showed off the most favorable health indicators, with optimal levels of MCH, low inflammation, and adequate iron and transferrin levels. As GNRI risk increases, these variables progressively worsen. The high-risk group showed the poorest results, with elevated inflammation and deficiencies in iron, reflecting substantial nutritional challenges and impact on overall health and well-being. My recommendations to senior citizens in any of these risk categories are as follows. Keep in mind, these recommendations are additive, so anything I recommend for one level, I also recommend for the risk level above that. For the no-risk group, I would recommend appropriately balanced portion sizes and sufficient caloric intake. The low-risk group should also begin to include vitamin C, D, and calcium-rich foods. They should begin to introduce anti-inflammatory foods into their diets. The moderate risk group should also start to have iron, zinc, and copper-rich foods as a priority in their diets. They should diversify their nutrient-rich vegetables, and it never hurts to introduce probiotic-rich fermented foods. Finally, the high-risk group should not just focus on iron, but balancing heme and non-heme iron options. They should also enhance the bioavailability of iron in their body by pairing it with high-quality proteins. These are my references. I'd like to thank Mrs. Jennifer Post, who taught me chemistry my sophomore year and AP biology my junior year. I'd like to thank Julia Starakovsky, who guided me through the research process. And I would like to thank the people who compiled this dataset and supported me throughout, Dr. Elizabeth Zeilinger and Matthias Unseld. Thank you, and feel free to reach out to me.